Prior to viewing this training, it may be helpful to download a copy of Time to Choose a Support Coordinator, a guide for individuals and families using DSPD services. This guide can be accessed by visiting www.utahfamilytofamilynetwork.org or by calling 801-272-1051 or toll free at 1-800-468-1160. Is it time for you to choose a support coordinator? It's an important decision, and we're hoping that this information answers some of your questions. This training is a supplementary tool for the publication entitled Time to Choose a Support Coordinator. It is intended to act as a guide for individuals and families using the services of the Utah Division of Services for People with Disabilities, or DSPD. We're going to begin by talking about what a support coordinator is. And if you are currently receiving DSPD services, which are also Medicaid home and community-based services, a support coordinator is a necessary role in those services. A support coordinator will work with the individual and families to oversee and monitor those Medicaid services and supports.
As you begin the process of choosing a support coordinator, the first thing that you want to do is find out all of your options. Ask around to other families who are using support coordination services and find out which company or private support coordinator they are using. Ask how satisfied they are with the services they are receiving and get a referral from them. If you know the support coordinator that you want to have provide your support coordination services, you can go ahead and set up an interview with that support coordinator. Ask them if they are willing to provide services for you or the individual that you support. Or you can ask if there are other support coordinators within that company who might be willing to take on your case. Support coordinators are somewhat limited. They do have a caseload cap, so you will need to ask if they have room in their caseload to take your client's services. If you do not know of a support coordinator that you would like to have provide services, then the first step that you would take is to contact your administrative program manager for your area. And you can contact that person by calling the DSPD intake toll-free number. That number is 877-568-0084. You can also find that information on the DSPD website, which is www.dspd.utah.gov. Once you've spoken with your administrative program manager, he or she will help you send out an invitation to submit an offer to the private support coordinators in your area, letting them know that you're interested in looking for a new support coordinator. And those support coordinators who are interested in providing services to you will contact your program manager, and at that time you will be able to set up interviews with those support coordinators who have responded to the ISO. Some of the things that we want you to remember as you're going through this process is that it is your right to choose your support coordinator, and you have the right to choose a support coordinator who you feel will work best to provide the services that you as an individual need, or if you are choosing a support coordinator for someone that you care for, your child or a person who is in your care, that you choose someone who is going to be the best advocate for that individual. Another thing that we want you to know is that the support coordinator fees are already included in your budget. There's no additional fee added into your budget for support coordination. So when you receive your budget, it will show that there is a line item for support coordination, but it does not affect or reduce the amount of service budget that you receive. One other important thing to remember is that anytime you wish to change your support coordinator, you do have the right to do that. You can choose a new support coordinator at any time if the person that you have selected is not working out, or if you feel they are not providing adequate service to you or the individual you support. you can make a new selection at any time. If you have a number of support coordinators from which to choose, you may want to do a phone screen first before you start meeting with them individually to save yourself time. Call the support coordinators who have responded to your ISO or who have been referred to you from other families and ask a few questions. You might want to ask how long they have been providing support coordination services. How often will they meet with you or the individual that they are supporting? Do they work independently or do they work with a company, a network of other private support coordinators? What is their current caseload and their availability for being contacted? What is their policy for being contacted if you have an emergency? And do they have someone who covers for them when they are not available?
After you've done a phone interview, it's a great idea to set up a face-to-face interview. And sometimes if you are the person that's receiving the services, it's a good idea to have somebody else in the room with you, helping to observe the interview and give feedback to you after your interviews are done. If you're just a family member, but you're uncomfortable with doing this yourself, you can certainly invite in someone to help you with the interview that way. If you're making the decision on behalf of your child or family member or somebody else, it's really important to include them as much as possible in the interview process. It's good to see the interaction between the prospective support coordinator and the individual, and vice versa, to see how the individual responds to the support coordinator. And you also don't want to give the support coordinator any unrealistic expectations about what your individual can or cannot do. So you want to be sure it's a realistic picture that you give the support coordinator about the needs that your individual has. It's great to set up a face-to-face interview with, if you have several to choose from, you could take your top 2 or 3 choices and set up an interview with them. And then you can ask further questions about the support coordinator and decide if they're going to be a good match for you and for the individual that you're interviewing for. So there are several questions that you could consider asking the support coordinator at this point. Sometimes it's good to know their educational background, why they chose this field to work in, and what experience they've had in this field. It's good to maybe ask them to share a success story when they have actually worked with someone with disabilities and perhaps helped improve the services that they were getting, or if they have any other success stories that they could share with you that shows that they were being a good support coordinator. Sometimes if they are actually in a business setting and they are running the business, it's good to know if they have business experience. If they've dealt with paperwork and finances and taxes and those kinds of things, if they are self-employed, it's important to know that they are going to be responsible in those areas. You may want to ask them if they are confident in their ability to advocate for the person with disabilities. With the DSPD, they need to have a good relationship with DSPD personnel and even with the providers that you might be using. So it's good to know that they have good advocacy skills and they're willing to stand up for the rights of the individual with disabilities. It's good to go through the budget with them and ask them how they feel, if there would be any improvements that they would make to the budget, or if they like what the budget says already, and might be a good time to brainstorm a little bit about what is going on in the individual's life and how the budget relates to that. And they should be making regular visits to the individual, so you may want to ask them to describe how they make visits and how often, and just describe what that visit might look like, so you can get a feel for how they're going to be visiting the individual. And maybe even ask them where they're going to be visiting them. And sometimes if the person is in several settings, it's a good idea to have them visit each of those settings so that they get a good idea, a good round picture. You may want to ask them what they see as their role in the individual's life, and again get some feedback on how the individual is responding to these kinds of questions. And then it's a really good idea to get references from other families or providers that have worked with this support coordinator, so that you can feel confident in the choice that you end up making. And again, throughout the entire interview, you want to make sure that the support coordinator and the individual are interacting comfortably, and that they both are feeling like they are getting a good, true picture of what's going on.
The support coordinator has many responsibilities in working with you or your family member. The primary one would be to first assess the needs of your family and of the person, and then to develop a support plan surrounding those assessed needs. Then to allocate the funding through the different service options that are available to you, which again, the support coordinator would be able to provide you with the types of services available in your area. If you are overseeing your own supports through the self-administered services program, to provide training and information on how to run your own program. Ongoing monitoring of the provider services, monitoring your budget to make sure that the budget doesn't get overspent, making sure that all the records are kept. As this is a Medicaid program, there are many requirements that are needed to be kept, and so the support coordinator can help you do that. Refer you to resources in the community through your Medicaid state plan services. Overall, monitoring health and safety and coordinating all of the services and supports available to you. I think also it's important that that person is there to listen to you and your family and to find out what the needs are. There is a confusing maze of services, so assisting you to navigate those services and just getting to know your family member, knowing you, to better support you, to see a holistic view of your life. Visits should occur in the home, at school, in the workplace, in the community, with providers, without providers, just so that they get a picture of who you are and what you need. And basically to be a support to you and your family. Those are the primary responsibilities. Of course, there are numerous ones, but those are the ones that we'll just highlight for now. Or to help you go through this process, please contact the Family to Family Network in care of the Utah Parent Center. Again, the numbers are 801-272-1051 or 1-800-468-1160. Or you can email at information@utahfamilytofamilynetwork.org.